compliance with building codes and standards, as well as other industry regulations. I have proposed an allocation of 2.6 billion for the regulation and development of the construction industry. I am aware I know members are aware of the challenges we have had where collapsed buildings kill many Kenyans as a result of carelessness of various developers. Let me turn to universal health coverage. Mr. Speaker, access to quality and affordable health care through the universal health coverage program is central to this government. Towards this end, Mr. Speaker, I have proposed an allocation of Kenya shillings 138.1 billion, up from 123 billion in the current year's budget, to the health sector to support various activities and programs. This includes 6.2 billion for universal health coverage, coordination and management, 13.1 billion for primary health care, and that is up from 7.1 billion in the current year, and 430 million to provide medical cover for the orphans, elderly, and disabled persons in our society. Mr. Speaker, to lower cases of HIV, AIDS, malaria, and tuberculosis, and enhance vaccines and immunization program in the country, I have proposed 17.3 billion for the Global Fund and Kenya shillings 4.6 billion for vaccines and immunization programs, respectively. Mr. Speaker, to enhance early diagnosis and management of cancer and reduce the burden of treatment of chronic and critical illnesses among Kenyans, I have proposed an allocation of 8 billion to the Emergencies, Chronic and Critical Illnesses Fund to be managed by SHA, and this has moved from 5 billion shillings in the current budget. 1 billion for construction of a cancer center at Kisii Level 5 Hospital, 100 million to strengthen cancer management in Kenyatta National Hospital, and 100 million for expansion of comprehensive cancer treatment at Kenyatta University Teaching, Referral and Research Hospital. Mr. Speaker, to improve health service delivery, I have also proposed a sum of 42.4 billion for our referral hospitals, including Kenyatta National Hospital, Moi Teaching and Referral Hospital, Kenyatta University Teaching Referral and Research Hospital, Mwai Kibaki Teaching and Referral Hospital in Othaya, Jaramogi Oginga Odinga Teaching and Referral Hospital in Kisumu, and Mathare National Teaching and Referral Hospital. Other locations include Kenya shillings 1.3 billion for the construction of Kenyatta National Hospital, Burns and Pediatrics Center. Mr. Speaker, I have also proposed 5.2 billion for Kenya Medical Supplies Agency to recapitalize it, 2.7 billion for the Kenya Medical Research Institute, 500 million for procurement of family planning and reproductive health commodities, and 300 million for procurement of equipment at the National Blood Transfusion Services. Further, to strengthen the capacity of medical personnel, I have also proposed an allocation of 4.3 billion for medical interns, 3.2 billion for community health promoters, 303 million for training of health personnel, and 8.9 billion for the Kenya Medical Training Centers, KMTCs. On digital superhighway and creative economy,